I have I guess, a few things to maybe kick off some of the discussion, but by all means, you can start feeding questions to Ginny if you'd like to do that. Um, there's been a lot of discussion about what's going to happen in the fall, and you may have heard rumors about starting or stopping the semester early as far as instruction. And some decisions have been made about that. Classes will start as scheduled on August 17th, and midterm week will be just right around that first part of October, October 5 through 9. But we are going to stop fall semester early. Well, let's say we're going to stop face-to-face instruction early. The semester will actually continue until its normal stop date, but face-to-face instruction will conclude on November 24th, which I believe is the Tuesday before Thanksgiving. So in the past, we'd had Monday, Tuesday, Wednesday off of Thanksgiving week. Well, actually the whole week off, right? But we will actually have classes on Monday and Tuesday of Thanksgiving week. And that will be the end of face-to-face instruction. Thanksgiving break will be the 25th through the 27th, and then we will have online finals scheduled November 30th through December 4th, with grades due on December 15th, which I think the finals week and the grades due are about the same time period. Maybe it's moved up a week for the finals. If we have to have exceptions to that, for example, if you need to do face-to-face assessments or other things, or if there's just a necessity to to have assessments of students that extends beyond that Thanksgiving week, I think that there will be a process for exceptions to be granted. We are supposed to have, I believe it's 75 days of instruction in a semester, and we usually have some additional days built in. So I haven't counted the days up, but I've been told that that we still add up to 75 days of instruction by adding these 2 days during Thanksgiving break. So it's probably not, I'm happy to try to answer any questions about this. This has just been released in the last little bit. But it's probably not best to get too far into the weeds for individual programs related to this, but we're happy to take questions about what's looking like an abbreviated fall semester. This was decided, and many institutions have done a similar sort of truncation of fall semester because they didn't want students dispersing for Thanksgiving break and then potentially bringing back COVID to campus after Thanksgiving for just a short period of time, and then disrupting finals and otherwise. So that was the primary decision point there. There have also been some, I guess, a lot of questions about supplies. Face coverings, hand sanitizer, those kinds of things. There are processes that are being worked out right now with purchasing and facilities to make those kinds of supplies available more widely on campus, and creating a situation where all employees have face coverings, for example. And I think the plan is to purchase 2 for all employees so that you can wear one and have one in the wash. The plan at the present time is that face coverings are expected on campus. That's the terminology I think we kind of settled on today at an admin council meeting, that we expect people to wear face coverings, provided there aren't dramatic changes in the disease prevalence and that kind of thing. That we will move forward with at least many sections being face-to-face, and that there's going to be an emphasis on face-to-face instruction for 100 and 200 level general education type classes. Although in many of our programs, we'll be able to continue with sort of similar. Our cohorts aren't necessarily that large. There will be, though, physical distancing. There may be room changes. And there's going to be a lot of stuff still worked out over the course of the summer in terms of logistics to be able to deliver this. There will undoubtedly be more sections because we're going to have to dilute the students out a little bit, well, really substantially in some classrooms. And so with more sections, there will be some impacts on workload. So we need to begin talking about what these implications might be. We certainly don't have all of the classroom assignments worked out yet, but we're going to be working with facilities and with the registrar's office to be able to figure out how we can maintain physical distancing as well as accommodate facial coverings and that sort of thing in the classroom. One of the things that has led to these decisions being made, at least at this point, are that about 80% of students surveyed have indicated that they really, really missed on-campus and personal interaction with their professors and with their classmates. And I think that in many ways, this is a very positive thing about the impact that all of our faculty have with our students, and the fact that online education is probably not preferred, at least not widely preferred, at least not for all of the students' education. So I think it's very reaffirming, I guess, of the role of faculty mentorship and interaction and having those kinds of opportunities available in the classroom. So the president has very much committed to working towards being as near normal as we can be in the fall. But as we develop the class schedule, I mean, the class schedule is basically developed, but as we develop a modified class schedule, room scheduling, those kinds of things, there will need to be some flexibility across the university to be able to accommodate what will amount to be many more sections of some courses just because of the physical distancing requirements. I'm going to pause there for just a second. Chris Owens, I see you're here. Do you have anything to add? Because I know you sit on that instruction group. Is there anything about, and I know we're not set in stone yet for sure either. Do you want to add anything about how classes might be set up and the impact that's going to have on faculty and students?
Yeah, sure. I think you summarized it really well, though. And these pretty much everything is on the table at this point. And we're looking at spaces ranging from the Stevens Performing Arts Center to the sub ballroom to every single space we have on campus. And what we're finding out is we don't have very many large spaces. If we want to have a class of 100 students like biology or chemistry 101, we're going to use the Stevens Performing Arts Center for that to have the adequate distancing. So with that in mind, we're looking at every single space and then trying to prioritize as well 100 and 200 level courses as having those spaces for the student experience. These are new students on campus. We want to give them that on-campus experience as much as is possible, but it's become kind of a Rubik's Cube of, okay, if we do this and prioritize this, then what does that knock out? And then what do we have to do from there? And it's going to be an iterative process as it goes on over these next few weeks, several weeks over the summer to get all of this pulled together. But we do have representatives from all over campus, including several from DHS as well. And so I like to think that it's a good representative group looking at the issues from all the different angles.
Thanks, Chris. I didn't mean to put you on the spot, but I realized as I was talking that you're there each week or multiple times a week, some weeks for those discussions. It's just amazing how some of these things have taken over our schedules for sure, too. I feel like about 70% of my time is taken up with things that I wasn't even doing 3 months ago. And I'm sure many of you feel similarly. It's just been a total disruption of business as usual for sure. Jenny, are we having any questions come in yet?
We are. We have a few related to what you've just shared, the information you just shared. And so I'll start there and then circle back to budget questions. The first question is, does early date apply also to online course instruction?
I'm sorry, does early date? I guess I don't understand the early end of the semester.
I'm
Is that
assuming
what
that's
people
what
are
that means.
referring
Yep.
to? Yeah. Okay. My understanding is that online courses can probably continue as usual, with the finals being administered during the time that I outlined earlier, which is November 30 to December 4. So there may be a slight bit of compression there, but that's my understanding. Chris, have you heard otherwise?
No, I think that's right.
Yeah. Okay.
Okay, thanks. The next question is asking for comments on how faculty should coordinate, or finals week, and how to coordinate among faculty.
Well, I think that's going to come down to what's happening in each individual program. At one point, the group was thinking about compressing finals into those 3 days or 2 days before Thanksgiving, and obviously that would have been very, very demanding for the students. My understanding is that we'll have a final schedule, that it will be similar to the way we do it. Some of those online exams may be open for a period of a day or two, or that kind of thing. Those details haven't been totally worked out at this point, but that's what's being considered. And so it's going to be more of an open time period that finals need to be completed in. The mechanisms for online proctoring and that kind of thing are still being worked out to some extent, but obviously there's going to be an increased demand or need for online proctoring. And so Blake Beck and his group, which Chris is a part of in that committee, will be working on ensuring that we have online proctoring resources available too. There's going to have to be some details worked out there within a program to be able to schedule the finals. But I think that we'll have the resources here as we move through the summer to be able to plan that out appropriately.
Thanks, Rex. Next question. With exams after Thanksgiving, how does this reduce the risk of students going home and returning over Thanksgiving?
The students are not asked to come back after Thanksgiving. They will be administered online finals for the most part. Now, as I said, there may be certain classes where we have to have some sort of hands-on assessment. There will be an exception process to be able to do that. And I'm just thinking about, some of our very much hands-on programs. I know that the summative assessments in some of the programs where we do have to lay hands on each other in terms of making an assessment, making sure students are prepared, don't always occur during finals week. But we will work on that kind of scheduling. But the goal for most more traditional didactic courses is that students will not come back to campus at all after Thanksgiving and will take their exams online.
Thanks, Rex. Next question. What are the mask requirements for students?
So it hasn't been 100% decided, but I think it's going to be somewhat like what I outlined earlier, and that is that facial coverings will be expected on campus. If you all have, if any of you have looked at the CDC guidelines for institutions of higher education, and they're available on the CDC website, there's a low, medium, and high risk category for institutions, and the lowest risk is completely online instruction. The medium risk is 6 foot physical distancing with facial coverings. High risk is basically back to normal. We are trying to fit into the medium risk category, recognizing that if we had an increased rate of disease, in our communities, we may see a backslide and a movement back towards online education. But that requires, or at least expects, facial coverings and the 6-foot distancing. So we will have an expectation that students wear facial coverings. We'll also have an expectation that faculty likely wear facial coverings, and we're looking at face shields, a clear face shield, because there are some students that need accommodations to be able to read lips, for example. So as we're still working through some of this, and some of this language is not finalized, but the expectation is that wearing is caring, and that wearing a mask is caring for one another, and we're going to work on that kind of messaging and language throughout our programs to try to change the culture. You know, I kind of made the joke at our admin council, we've lived with no shirt, no shoes, no service for a long, long time socially, walking into a restaurant or whatever the case may be. We've managed to not have smoking on campus. We're going to try to manage to have facial coverings be a part of what the social norms are, but we understand that it's sometimes a politicized issue. It's an individual freedom issue. It's going to be difficult to change that culture, but we want to begin some messaging on that over the summer and have the expectation that people wear facial coverings when they're in a classroom together.
Thanks, Rex. Will students be offered an all online version as well, resulting in a hybrid class structure?
So there are actually, and Chris can probably talk about this better than I, there are actually about 9 different instructional methods that have been identified, from pure online to pure hands-on in the classroom, and just about every option in between. So the answer is yes. In many cases, there will be what's called a high flex option that will have online components or synchronous or asynchronous viewing of lecture in addition to live. Because classrooms will have a decreased capacity, we're going to have either a synchronous or asynchronous or both option for students to be able to, and Chris talked about some of these large section courses where we simply do not have a classroom that can accommodate more than 100 students with social distancing. I think the sub ballroom, they measured it out and it's at 77 students or something close to that. So with 6-foot physical distancing. So the point is that we're either going to have multiple sections to have live instruction, or we're going to have these options where students can watch maybe in a different classroom live, or do it asynchronously via recordings. So there will likely be multiple options in multiple different courses as we move forward, and those details are not yet ironed out.
And if I can just add, when possible, we do need to have those recordings made of classes, because there will be times when a student is sick or is caring for sick family and is told not to come to campus, and we want them to not be on campus. So they're going to need to have some kind of option for almost every kind of scenario that's out there.
Thanks, Chris.
Thanks, Chris and Rex. Next question. Cutting the semester short will impact required clinical hours. If students do not travel over Thanksgiving and are COVID screened, are they able to continue clinical rotations through December 11th, the true end date of the semester?
So I think that's a great question, and I haven't seen that specifically addressed. My guess is that for those students that are out on clinical rotations and getting clinical hours and are out at a remote site, that those students will be able to complete their required hours. That's the exact kind of exceptions that we need to know about, and that we need to build into the accommodations and as we build this schedule for the fall. But my understanding is that we will absolutely do our best to accommodate that kind of necessary instruction that's sort of mandated by either licensure, accreditation, or both for students to get an appropriate number of hours.
Thanks, Rex. And will instructors have a choice to provide live instruction or to present online?
So in some situations, yes. There are certain situations, for example, where we've heard some instructors are very much uncomfortable presenting live, perhaps due to the care of vulnerable individuals in their household or health conditions in themselves. And so those are the kinds of things that we absolutely want to begin dialogue about to have an understanding of whether a course should be or could be delivered in an online versus a live format. That being said, the president has really, I think, emphasized the fact that we want to have as much online instruction as possible, but people shouldn't be forced into that if they are not comfortable delivering in that kind of a setting. Or we need to do a better job of accommodating that and making the classroom or laboratory safer for the faculty and or students.
Okay. Follow-up question about the communication that went to students. Who received the notification about the change fall calendar? I asked because if students received it and they have only online classes, they'll need clarification that the calendar may not change for them.
Yeah, that's a good point. I actually don't know who all got it. I saw a draft memo. I see, Sue, this is from you. So I don't actually know who all has received that communication. This is literally in the last couple of days that I've heard about this. So it may not have gone out widely to all the faculty, and I don't believe it's gone out to students yet. But you're absolutely right. It doesn't change the calendar if people are online.
Thanks, Rex. Are faculty and staff currently on campus supposed to be wearing masks?
During stage 3, facial coverings are recommended to continue. Social distancing is recommended to continue. So we're following the governor's outlined plan. It's available at idahorebounds.gov or some website like that. If you Google Idaho Rebounds, you can find the elements of the plan. But certainly at the present time, folks are to be continuing to wear facial coverings, encouraging people to telework. That non-essential travel is still somewhat limited, although it can resume to areas where there's low levels of ongoing disease transmission. There's a variety of different criteria, but sort of that baseline. You got to wash your hands. You stay at home if you're sick. You don't. You got to cover your cough and cold and sneezes. You have to wear face masks or at least facial coverings when out in public. All of those actually continue through all 4 stages of the Idaho Rebounds plan.
Rex, can you clarify what stage we are in right now? And someone is reporting that where they are, no one is wearing masks.
Well, I certainly have experienced the same. I get funny looks. I was in Ace Hardware the other day, and I'm the only person wearing a mask around in that establishment. So there's no question that mask use is highly variable. I will say that if you go to Costco after 7 p.m., you're going to see a lot of adherence with mask wearing, at least in Pocatello. Because 99% of the people when I was there the other night were in fact wearing masks or facial coverings. So we are in stage 3 right now. It just started on Saturday, May 30th, and we go through June 12th with stage 3. There are, and I'd encourage you to look it up on the Idaho Rebounds website. You can download the guidelines for opening up Idaho, and it will go through the expectations for each stage and how they change, and it will provide you with the right kind of guidance. Now, that being said, I believe the governor opened up movie theaters and bars and nightclubs a stage earlier than is in the draft that I have here to get to get those establishments up and running sooner than the original proposed date, which would have been in stage 4.
Thanks, Rex. I'm going to share the Roaring Back for employee guidelines. That's the link that should tell all employees for stage 2 and 3, which, as Rex said, we're in right now. And we are working, that committee is working on getting the guidelines for the next stage as soon as possible. And related to that, Rex, is June 15th the first day that all staff should return from telework?
So, you know, to say that it's a blanket date and that everybody must return to work on that day is not correct. And even on our Roaring Back documents, we talk about a new normal. The new normal, still, we need to make accommodations for folks that have vulnerabilities, particularly to severe COVID illness, or are caring for in their household or have household members that are at high risk for complications with COVID. So to say that everybody's coming back to work normally on June 15th, which is basically the Monday of stage 4, is really not correct. The folks need to talk with their supervisor, and really we're supposed to be coming up with plans for what staffing looks like. And I know in each of your units, it's very different. In the divisional office, for example, we have a couple of offices where people share a relatively small space. Even in stage 4, we're likely going to have those people work staggered shifts so that they're not overlapping in the same space for all day, every day. That some may work in the morning and telework in the afternoon, and vice versa for the other employees. So it depends a little bit on your layout, and it depends a little bit on the vulnerabilities of the people in your office. It is possible for us to be back working at our new normal at that time if we progress into stage 4, but recognize that even in stage 4, we need to maintain social distances, we need to wear face coverings in public, and all of those other things that we talked about. So I would say you talk with your supervisor, your department chair, your dean if necessary. If you have specific questions, you can certainly talk to the divisional office. We're happy to help with that. But we are moving back towards a new normal, which is not 100% normal, on the beginning of stage 4, June 15th.
Okay, thanks, Rex. And as Kathleen mentioned, and Ted as well, the email to students did go out yesterday. And it's from my office, Marketing Communications. And I know Leanne is on here and has received that email as well. So maybe she can help me get that wording out to everybody so that they can see what students received. Okay, next question.
Yeah, thanks for clarifying that.
Yeah, you bet. Next question, are there resources for contributing masks to students? If we're willing to donate masks, cloth, home sewn, is there a way to do that? Do we have access to 3D printers for face shields? I'm essentially asking how we meet mask demand when we go live.
So there's a ton of work going on behind the scenes to address all of those issues. The answer is face shields, and I'll start with face shields. Face shields have been one of the things that's been in shortest demand. So even when we collected PPE from all of the different administrative units, face shields were in very, very short supply. And so there is an effort to procure those through normal supply chains with medical device manufacturers, but there also is the opportunity to 3D print face shields. So we'll be perhaps using both mechanisms, that is ordering them as well as potentially producing our own. The plan is to be able to have some sort of facial coverings available for our students. I already mentioned for our faculty that was approved, faculty and staff. University employees, that's already been approved to purchase 2 facial coverings for every person that works on all of our campuses. The students, we're working on different ways of being able to procure different types of facial coverings. It's likely that we will have cheap disposable facial coverings available when people enter buildings. much like when you go to the hospital during flu season, and by the elevator or by the front door, there are facial coverings for people that have a cough or cold, as well as hand sanitizer. So all the details aren't being worked out yet, but there are plans to make that available for students, staff, faculty, everybody on campus one way or the other, and that will be purchased. It's sounding like centrally, that we can use CARES Act funding to be able to do that, and be able to hopefully meet the needs of our campus community. I will say we went through an exercise a couple of weeks ago where we estimated the entire campus community's utilization of cleaning supplies, hand sanitizer, and face coverings, and submitted that to the state to let the state know. And they were doing this with all the different state agencies, what the volume might be for us to need to procure that. And we were given the instruction to come up with a typical month. And we use September as our metric because we'll be back running at full force, hopefully, to be able to come up with those numbers. So there's been multiple efforts to be able to identify the need and the utilization of that equipment moving forward. Now, that didn't necessarily include the utilization in our clinics. And so that's an additional cost. We want to be able to track that cost and that utilization as we move forward too.
Rex, I'd like to add two things if you don't mind.
Sure.
Just the question about donating masks. Nancy Fox in EHS is the person to contact about that. We are currently collecting donated masks. We have a great group in Performing Arts who has already donated 200 of the cloth sewn masks, and are at the Bengal Depot right now. And the second part that I wanted to mention was, if you look at the Roaring Back guidelines that is in the isu.edu/Roaring Back, supervisors for this stage, people who are currently on campus, can request face coverings for employees who are currently on campus. So if you don't have a face covering, there are some available through the form on that list of guidelines, and those will be sourced out. They're available. They will be distributed through the Bengal Depot. And the Bengal Depot will be key in distributing the employee coverings that Rex mentioned.
Thanks, Jenny. I neglected to answer about half of that question, so thanks a lot.
Yeah, no worries. There are a few in that one.
Bengal Depot is basically a warehouse storage that's run by facilities, and they work with purchasing to procure all kinds of cleaning supplies, but also this kind of equipment.
Okay. Next question, Rex. What is the approximate timeline to hear back when a health exception request form is submitted? And should the current form be used for fall semester class clinic activity exception requests?
So I think at this point, it's fine to submit those for fall requests. We are getting fall requests. We have a committee of about 5 people that looks at those requests each week. We've done over 100 of those so far. And usually people should hear back within a couple of, the meeting of that group is every Thursday, so they should hear back by Friday or Monday on those requests. Now, I will say that because of the volume of these requests that have come in, the committee doesn't look at some of those requests that might be starting, for example, for fall semester, at least not right away. We've been prioritizing those that are in late May and June, the first couple of rounds of review. So if those health exception requests have come in, we typically will look at them by Thursday of the week that they come in, and people should get a response by Monday. The exception being if the start date of the event or the class or the activity is in August, for example, we may have put some of those off. And it's really just a volume issue. Some of them take a long time to go through. As you might expect, if we're having, traveling basketball teams come to campus and they have, they want to have basketball tournaments and that kind of thing. It takes a lot to sort of sift through all of the different activities and make sure that we're addressing all of the different elements for that kind of activity to come on campus. And it depends when it's coming on campus and where the teams are coming from, et cetera, et cetera. So some of them are straightforward and easy, and others take us, 15 or 20 minutes to go through and have a discussion about. So can be a time-consuming process, and we prioritize those that have events sooner than later at this point.
Rex, when will on-site interviews be allowed, or will we continue with virtual interviews for some?
So you cut out right at the end, Jenny. Continue for virtual interviews for students, for example, and faculty, or?
When will on-site interviews be allowed, or will we continue with virtual interviews for some time?
So I would guess that in many situations, it's reasonable to continue with virtual interviews. Now, that being said, when we look at the Idaho Rebounds documentation, travel is certainly loosening up. And so I think that it's going to, in some cases, it will be individualized. If people are coming from areas where there's ongoing and high levels of ongoing community transmission, it's reasonable to evaluate that and question whether that student or faculty or staff should travel from that location. What we've been suggesting people do is that they look at the Johns Hopkins GIS website that drills down to county level data and be able to determine which counties have the highest levels of ongoing transmission. What we've typically done, and this is somewhat arbitrary, and we could argue about the utility of this methodology, but what we've typically said is that if people are coming from the top 3 categories of ongoing transmission, and this is benchmarked against the national rate of illness, then people should not be traveling to Idaho. Now that it's a moving target, right? And it will change over time. But at this point in time, we are not recommending that people who are coming from high areas of disease activity interview on site.
Thanks, Rex. When will we know if and when our donated PPE is going to be given back?
So we've come up with a plan. And it's a little convoluted, but I'll try to explain it to you. And Chris, if I goof anything up, feel free to jump in here. Basically, in the governor's plan, one of the criteria, one of the metrics for moving from one stage to the next is that we have a 10-day supply of PPE at health facilities. So what we have done is we've looked at the burn rate and what the maximal burn rate might be if the pandemic were to flare again. Look at the burn rate of our PPE and made a determination what's an estimated 10-day supply. We've kept that as sort of the baseline of PPE that's going to be kept on our campuses. And then what we've decided is during stage 3, the stage that we're in now, and during stage 4, we will return about 25% of the excess of that stockpile that we need to keep on hand back to the programs. Now, I will say that all of the programs will have certain things returned. For example, foot coverings, shoe coverings, and hair nets were donated. That's not considered to be essential PPE for COVID care for our clinics, and so those are being returned straight away. We had very few face shields, as I mentioned earlier, and so all of those are going to be kept for now until we can begin sourcing face shields or 3D printing face shields to build up our what would be considered a 10-day supply there. So it depends on the piece of equipment that we're talking about, and it depends on what the estimated burn rate of that PPE was. That being said, we have everybody's donation quantified, and the goal will be for us to reimburse for central administration to reimburse the programs for the PPE that was contributed through CARES Act funding, and that's been tracked and inventoried. But we were very, very cautious to give back too much of the PPE, given the fact that the disease could flare and then we'd have to ask for it back. The reason that we're keeping the PPE is for use on our campuses, but also so that we have a bit of a supply to contribute to our communities if it came to that. I'll just add one other thing, and that is that part of the metrics for moving from one stage to the next are having the availability of PPE across the state in all of our different health facilities. And so that's one reason we utilized that as one of our metrics for identifying what PPE could be returned to the departments.
Okay. Rex, this next question, our department chair told us CARES Act funding is not happening. Is this not the case?
I haven't heard that at all. And I all heard today that there's a second round of CARES Act funding coming, and that we may even get indirect cost recovery for that second round of CARES Act funding. So I haven't heard at all that CARES Act funding is not coming. I do have some, I guess, I'm a little bit skeptical about the state and the governor's education, and I don't have the name right, but basically there's an education relief fund that the governor has set up, and my understanding is that the bulk of that fund will go to K through 12 education, but that's not the same as CARES Act funding, which comes from the federal government. So I haven't heard that that's not available or not coming. We can do some checking and try to track those rumors down. But my understanding is that there should be some funding coming to higher ed through the CARES Act. Well, we know there is because some of it's being distributed to the students already.
Okay. Thanks, Rex. Next question. How is travel going to be considered between campus locations, for example, from Pocatello to Meridian, for support going to be handled with cost cuts and restrictions? How is travel going to be considered between campus locations, for example, for Pocatello to Meridian, for support going to be handled with cost cuts and restrictions?
Yeah. So obviously our travel budgets have been impacted across the division and across the university by just the budget cuts, let alone travel restrictions that could be in place because of the disease. Essential travel is going to have to still occur. And I see this question came from Julie. So for IT support, for example, between the two campuses, we're absolutely going to need to figure out ways to do that, but to do it in the most efficient, cost-effective ways possible and the safest ways. We still do have some budget for these kinds of activities. But we probably don't. We're probably going to have to plan our travel in a little bit more rigorous way moving forward. Obviously, we have situations that are emergencies, and servers go down or computers go down in a clinic, and we've got to be able to manage that. That's another reason that I think we need to look at cross-training different activities to make sure that we have the right kind of support on all of our campuses. But travel will be impacted. We need to plan that carefully, but it's not eliminated at this point.
Budget question for you, Rex. In our first meeting, a retirement buyout was discussed. Any development on this issue?
So there are developments on that issue, and the developments are that the state is not going to support the institutions of higher ed going for that kind of a program. So a retirement buyout is not coming. Those plans were not even submitted to the state budget and HR offices because we got feedback that it wasn't going to be well received. The U of I was able to implement a program in the last year for this kind of activity. But interestingly, because of the U of I's longstanding land grant history, they don't answer to the State Department of Human Resources. And that's one reason they were able to implement that program. But BSU, LCSC, and ISU and the community colleges were not able to offer that kind of a program.
Thanks, Rex. Has there been any discussion regarding PPE for our students and their supervised practice rotations? Our program traditionally doesn't need much PPE during rotations, but if we start needing more, who will provide it?
So that's a really good question. And in fact, one of the things that we're going to talk about at our extended HSAC committee meeting tomorrow, we need to know, for example, if PA students are being asked to bring their own PPE to their rotations, or nursing students, or any of our students are being asked to supply their own PPE. We need to figure out and understand the budget implications for all of this. So if you're hearing this for even a percentage of your students, we absolutely want to know about it, quantify it, and be able to put that into, for example, our CARES Act submission, and let Office of Finance and Business Affairs know of that. So that I'm glad that somebody brought that up. We don't have answers about the budget implications, but clearly they could be significant if all of our students are being asked to bring their own BYO PPE to their rotations, right?
Thanks, Rex. Next question. When will external search start for the new College of Health Dean? Who will serve in the interim role starting July 1?
So we are moving forward with the operational and organizational structure that we outlined a couple of months ago. We have begun to sort of consolidate a search committee between several of the searches that were ongoing last fall. And we'll probably use some of the same individuals that were involved in those searches, although we don't want to have gigantic search committees. And we just today received approval from Admin Council to move forward with getting the dean search for the College of Health off the ground. Now, that being said, that request still has to go to the State Department of Financial Management as well as the State HR Department for approval. We expect to have some announcements about the Associate Deans, that is the Associate Dean and Director of Nursing Education, and the Associate Dean for the College of School of Rehabilitation and Communication Sciences in the next few days. We had asked for nominations for the School of Rehabilitation and Communication Sciences Associate Dean position. And so we'll have some announcements about that and about the composition of the search committee for the dean here in the next little bit. Hopefully we'll hear back from the state so we can kick off that search for the dean any day now is what I'm expecting. Somebody asked about my title. My title has changed slightly, and I think it was back in maybe February that I had the title Senior Vice Provost added. That came with a bit of additional responsibilities in academic affairs, helping to represent the provost at different events and at different meetings and that kind of thing. Obviously, I still hold the title of Vice President for Health Sciences. If people have questions about that title, it's really just to, for the most part, integrate some of the things that I've been doing all along with the Office of Academic Affairs. And I work very, very closely with the provost and the rest of the academic affairs team on a daily basis.
Thanks, Rex. Another budget question. Has there been any discussion on change in furlough days with co-funded positions?
So you broke up a tiny bit, but I assume it was about co-funded positions and furlough days?
Yes, if there's any change to that process.
Yeah, so we've had some discussion about that, and I don't know which academic unit this might be coming from, but For example, a College of Pharmacy faculty member might be, are you guys hearing me okay? Okay. I just got a note saying my internet connection was unstable, and if there are problems, I'll kick my kid off his Xbox downstairs. So the question was about furlough days for co-funded positions. Essentially, the way that's being handled, and it kind of is in an individual basis, but if somebody has responsibilities at a clinic or a hospital or at another facility, we would ask that person to coordinate with their supervisor or supervisors to make sure that we were taking those furlough days on the time, sort of on the ISU time of the equation. So if somebody's co-funded between here and ERMAC, for example, they would take days or half days on the ISU side of the equation and not impact the sort of contractual and service obligations they have at the other health facility. That may be difficult to do, and if you have additional questions about that, we can work with HR and your supervisor, your chair, or your dean to work through those issues.
Thanks, Rex. Next question. Are there any liability concerns or additional insurance requirements for healthcare students that will be going on rotations?
So that's a really good question. I believe there are some liability concerns, and we've already begun talk about how we're going to talk with our students about, sort of what they're getting into. This is again on our agenda tomorrow at our extended Health Sciences Administrative Council meeting to talk about what each of the programs have in place. I have concerns about students being placed in situations that are dangerous and not having adequate PPE. I have concerns about students being put into positions where their preceptor, their supervisor at the clinical site may not meet the standard. And then I have concerns about our students going into clinical sites and potentially bringing illness. We've had a couple of situations already where our students have been infected or been to areas of very, very high disease prevalence and then wanted to go into clinic following up with that. And I think that we do need to have a new round of discussions about all of these issues with our students, that we have to have some guidance from risk management as we develop these policies and these talking points. And that's something we're working on over the summer. I recognize it's a moving target. We've got students on rotations now, but we're going to come up with some new policies and ways to address a bunch of issues related to COVID and being on clinical rotations.
Many of the clinical sites are asking if our students have been N95 fit tested for masks. Would we be able to implement this in KDHS and provide and schedule it for programs in need?
Again, you broke up a little, Jenny. Scheduling N95 fit tests for our programs?
Many of the clinical sites are asking if our students have been N95 fit tested for masks. Would we be able to implement this?
Yeah, I think absolutely you could contact EH&S. Nancy Fox and Jen Parrott could absolutely help our programs who have students or faculty that have the need to be fitted for these masks.
Okay.
But there's only a few people that do that actual fit testing, I would add. So if we're going to have to schedule a way that we can get, if it's a large number of people who need it, that's going to quickly overwhelm who we've got to be able to do that fit testing. I mean, it doesn't take long. It's like 15 or 20 minutes, but add that all together and that's a lot. So we'll have to work out those details.
Yep. Yeah, absolutely. It does take some time. There is some other equipment and supplies involved to make sure that the fit test is right? You have to, I guess there's some certain chemicals that you have to not be able to smell. So they have to order those things in. Some of that's been in short supply. But I would absolutely contact EH&S and do it sooner than later, because as Chris says, it takes some time, and these folks have been very, very busy since early March.
Okay. Related to that, someone mentioned they have over 100 people that need fit testing when we go back. And then Rex, any additional thoughts on transferring costs of PPE to students?
Well, I think that that needs to be part of our budget discussions and our planning. You know, we have expensive programs to operate. That's why we have professional fees. That's what professional fees are for. I hate putting additional costs on the back of our students, but the reality is that's one of the rationales for the existence of professional fees. So as we move into the fall and recognize additional costs and the cost to our students, it's much like we've talked about before related to some of the clinical onboarding expenditures, vaccinations, background checks, all of these things that are in fact additional costs. And I know our students feel nickel and dimed, but in the current budget climate, we certainly haven't budgeted for this, and in fact have had budget cuts because of this. We're going to need to figure out how to be able to build our budgets to be able to support these additional expenditures. And so we need to be thinking about this. We're going to start earlier in the fall than we typically do to talk about what our professional fees should be set at. And we have to provide, obviously a strong rationale for increasing professional fees, but it's definitely something that we need to consider because I don't think the CARES Act funding and other sources of funding are going to be long-term, right? They may provide some relief in the short term, but I don't believe that it's just going to be added to our base when our base is being cut, unfortunately.
Thanks, Rex. Does ISU have fewer than 500 employees? If so, is ISU recognizing the Families First Coronavirus Response Act legislation that was passed in March?
So ISU has more than 500 employees. I don't know the details of that act and how it might affect people at ISU. I think that there are, and we'll get more communication from HR about things like furloughs and unemployment and that kind of thing. So we'll get some guidance about that, but ISU is bigger than 500 employees, and so may not qualify for some of the small business, quote unquote, funds that are available.
Okay.
We have, just so you know, we have over 400 employees in the Division of Health Sciences alone.
Okay. Thanks, Rex. And we have time for one last question. Who will serve an interim dean for College of Health role, and can faculty nominate for nursing director too?
So we are going to move forward with appointing Karen Neal as the Associate Dean and Director of Nursing Education. So that's a done deal, and I might as well say congratulations, Karen, and thank you for being willing to serve in that role. The other question, I'm sorry I didn't answer it the first time. Sorry, I lost my train of thought. I see too many thumbs up going up for Karen. What was the second part of the question?
The second part was about faculty nominating for nursing director.
No, I guess it was the first part of the question.
Oh, who will serve an interim dean for College of Health role?
Oh, we're going to continue with the co-interim dean model. I do want to get the Associate Dean of Rehabilitation and Communication Sciences appointed in short order. And so we will have a co-dean model where Patty Marincic, Chris Owens, and I will continue to do some of the other dean functions. Obviously, that will be in flux as we get the associate deans onboarded, and we'll be sort of re-identifying job roles and responsibilities moving forward, but we'll have kind of an interim co-dean setup moving forward.
Okay, thanks, Rex, and I'll turn it over to you for the end.
Okay. Well, I wanted to thank all of you, and thanks, Ginny, for another smooth town hall meeting. If you have other questions and we didn't get them answered, we are going to have another one coming up. And now that I say that, it's June 8th at 10 a.m. Thank you, Connie. She's always one step ahead of me, so thanks. And we'd be happy to answer more questions. I know there are lots more questions about what's happening. And obviously things are changing very, very rapidly on a daily basis. And we'll have other rounds of town halls as we move along, because I'm sure we'll have new questions and new problems to address as we move forward with our new normal. But thanks to all of you for tuning in today, and thanks for all of your commitment to our programs and our students. And I hope people are able to take a bit of time this summer and detach and relax a little bit too.